I'd like to ask you a question. How many times have you seen someone doing this when they're laughing and getting their mouth open? It's because they're unhappy about their teeth. Well, there's a multi-million-pound industry out there trying to convince us that gleaming white pearlies are a possibility for all. Our guest here, Marc Mortiboys, is here to tell us just how effective a lot of the products on the market are now. That you see them all over the place. I'd like to ask, first of all, we don't really have white teeth, do we? Not many of us have gleaming white teeth.
Very few people have very, very white teeth. And the people that we think have really white teeth tend to just have a better contrast against their skin pigmentation, like people from Somalia, Afro-Caribbeans. That darker pigment of skin just hide contrast and creates that appearance that the teeth are much whiter, but they are generally quite white compared to ours. But ours are, I'd say, Caucasian teeth in general, and a lot of the Asian teeth are still have a yellow hue to them, and they do, as we age, they become more translucent as well, and the yellow or the greyness shines through. Yeah.
As I said, we've got all these kind of products now on the market. Do we have to be careful with these? Just as an ordinary Joe punter, rather than getting your dentist to do it, can you do it yourself then?
Well, by seeing what we've got on the table here, and this is only a small representation of what's now just growing and expanding. It's like they're all making love together, aren't they, in the counter? They're just like every day.
I've never thought of it in those terms, Mark.
But it's like that every day. You just go in and there's more and more dental products just appearing. And with claims now of floss now whitening teeth, so they're getting stains from in between the teeth. And something that may be useful for you later on, we'll talk about maybe later on, is a stain eraser or a rubber where you can just rub on the stains. Although, be careful with that one, because obviously that's very abrasive.
You don't want to do it too much.
Yes.
I want to start at the end here, because we've got a group of chewing gums and mint things here. I mean, certainly when I was a child, you were told chewing gum was bad for you.
Right.
But these days we've been told it can be good for you.
Yes, in some ways, chewing something after a meal is absolutely the best thing to be doing, because nowadays, with modern refined products, modern refined sugars and flours, there's a lot of potential for tooth decay forming after our meals. So what's recommended is that we eat something or chew something that will increase our saliva flow. And research has shown effective results with just chewing gum, as long as it's a sugar-free gum. All those on there are mainly now with xylitol. This is a product extracted from silver birch tree. And there's one, in fact, there that's now all the rage, supposedly, because it contains enzymes. And these enzymes now lift off the stains. I'm a little bit of a more of a natural approach type of person. And I don't see why we shouldn't just eat a piece of celery after a meal or something like that. But obviously some people do like the menthol taste, and in moderation, chewing gum is going to be reasonable. So yeah, give it a go.
Is this right, that it's not actually the teeth themselves that get stained?
Well, the stains really can only form on the plaque that forms after about 6 to 8 hours after brushing one's teeth. So usually after 1 or 2 days of missing with the toothbrush, a layer will form on there where stains can then absorb into. So if one was brilliant at toothbrushing and flossing, then maybe you wouldn't need them. No.
Because I will admit, as someone who drinks far too much coffee and actually smokes as well, that my teeth are not exactly, as you can see there, not right.
But isn't it interesting that there's only one tooth that's actually stained? And that tooth is the one that's slightly more placed towards your tongue. It's like out of the line of the arch of your teeth. So it's interesting that your general toothbrushing actually gets all the stains off. So
I'm good at brushing.
Yeah. So what we're seeing here is, if with a good technique, you maybe don't need these stain removers. And obviously, if you do have teeth that do cross or overlap, then these products could be very, very helpful. So let's promote better brushing, and let's promote
it's not my fault, then.
Better cleansing. But one word of caution is that even toothbrushing without toothpaste is abrasive. Even toothbrushing with normal toothpaste is abrasive. Right. So even though these claims are that these products are very safe and very okay for teeth, I would still just tread gently with all the dentifrices,
Yes, because we've got all these kind of things now: toothpaste, mouthwashes, flosses, and everything. Again, the way they work, aren't you having to scrub away your teeth?
Okay. All the claims are now showing that they're not as abrasive as the ones that first came out maybe 10, 20 years ago.
So they've improved?
Yes, they have improved. The abrasives are much milder. They're now agents in these toothpaste to actually stop and prevent and reduce tartar formation and plaque formation. Some of them contain other products. Some of them are patented, so we don't know what's in them. Yet again, this other product, the company that produces this chewing gum, actually now has this enzyme-incorporated toothpaste as well. So maybe we're going towards biotechnology in the future with enzymes and things like this.
Now, when I go to the dentist or the dental hygienist to get this cleaned off, which is quite often, they seem to scrape away. I don't really know what she's doing in there. What's the dentist do that's maybe different or the same as these things?
Okay. One of the tools that we tend to use nowadays is ultrasound. We use ultrasound vibration and water spray to just break off and take away the surface of tartar or plaque that's hardened on the surface, and that will then automatically remove the stain. There are significantly strong brushes that we use on the teeth, but because it's only a one-off and maybe once every 3 months or once every 6 months used, even though it's mildly abrasive, that's fairly reasonable, I would say, to occasionally put on your teeth. And that's my word of caution. Even though most of these products will say that you can use them every day, I would urge people maybe just to try them out for 1 or 2 weeks. The claims are usually within 2 weeks you'll notice stain removal. Try them out for 2 weeks, and if you don't feel you're getting the results that you want, then go and see a dentist and just ask them, are my teeth suitable for this kind of product? Do I need anything else? And what I really urge people also is to fundamentally accept and learn to love themselves as they are, and let's not allow market forces.
We're not
to
all going to have teeth straight out of Dynasty in Dallas.
Exactly.
And one thing very briefly, I just want to know about that, the eraser. You can actually rub off the stain?
Yes. Yes, it's just an abrasive rubber tip that will actually brush off the stains and will be great around fillings. If you've got little white fillings that are starting to stain, rub it on there or rub it around little corners where nooks and crannies where stains are forming, but not aggressively and very gently. Be respectful, and I'm confident that you'll get good results. And if in doubt, go and see a dentist. Or
one final thing, hopefully we've just got time to show something. You can actually get a veneer, like a little cap put on, to make it very white. In
unfortunate situations where people have a very dark stained tooth, maybe from fluorosis or from tetracycline staining, then sometimes we have to be a bit more surgical and actually remove the surface of the tooth and just paint and bond on, glue on a little shell of porcelain, which is exactly like a false fingernail that will bond on. We're getting very good results in terms of lasting a minimum of 10 years.
Oh, right.
So if one's really desperate, it feels they've got really dark teeth and really want to change things, get some advice.
It costs a lot, though.
Not really. I think in terms of comparing, I've always used this one, comparing to re-roof a house or to fix a car, it's all in moderation with those kind of fees.
Right. Yeah. OK. Well, thank you for that, Mark.
Pleasure.
I might actually be able to do it myself rather than go to the dentist. Excellent. Yeah, thank you. Now, way back in April of this year, we discussed the collaboration between the frozen food company Iceland and the Missing Persons Helpline.